Episode 1: The Future of Australian Healthcare, Moving from Reactive to Proactive Host. Here at Future Health Australia 2034, we're looking at healthcare as it's changed in the past 10 years. I am your host Camilla, and today we're saying, what if health was transformed from the reactive care we provide when things go wrong to proactive care, where AI helps us to identify diseases before they begin?
Exactly, Camilla. Back in 2024, medicine was a relatively reactive industry. We diagnosed illnesses when they started showing up. Now, however, thanks to AI and predictive health technologies, we can spot problems much easier. This transformation has had a deep impact on the Australian healthcare system.
It really has. More specifically, it has changed the access to healthcare for rural Australians who previously struggled to afford it. Now, with AI-enabled telemedicine and predictive tools, people in remote locations can get the same care as their urban centers.
Exactly. The rural population was previously dependent on overwhelmed public hospitals with few specialist resources available. Now, AI health monitoring allows patients to be kept updated regularly, and physicians can act before they develop critical illnesses. This is saving lives and relieving hospital of the burden.
Exactly, Naomi. Australia's healthcare system in 2024 was strained, overcrowded hospitals, long wait times, and a reactive approach to the medical system. AI, however, has altered the rules. Through health data analytics in real time, AI algorithms can sense slight deviations in the patient's health and tell their clinicians to act before a patient develops symptoms. The latter is particularly crucial in rural areas where accessibility to a hospital is limited.
So, we're talking about early detection, so you can get to early intervention. But what about averting it? And how does AI stop conditions from arising at all?
Great question, Camila. AI systems can make health risk predictions based on a patient's way of life, genes, and history. For instance, if the subject is at increased risk for diabetes, the AI will alert them and advise on ways to prevent it, such as changing their diet or exercise routine. This enables doctors to collaborate with patients before they are diagnosed rather than waiting for one.
And avoiding is so important, but not merely infiltrating disease before it starts. You have to prevent them from happening. We're getting fewer hospitalizations and a healthier population because of this focus on prevention.
It's exciting to imagine how this is altering our relationship with healthcare. A decade ago, you saw the doctor only if you had an illness. In a new world of AI and permanent surveillance, people take greater care of their bodies. They're taking responsibility for their health.
Absolutely. And patients have a voice in this new paradigm. They know what their health numbers are, what their health patterns are, and they can make good decisions. But there's also the challenge of handling all this information. AI is designed to help patients and clinicians crunch through an enormous amount of data and identify what's relevant.
You can just imagine how patient-doctor relationship is transformed by AI. Physicians can now reinvest more time in patient as AI is doing most of the diagnostic and monitoring.
And that's just the tip of the iceberg. The healthcare landscape in Australia is set to continue to improve as AI continues to keep us healthier and longer. In the next episode, we'll explore Nico Health and how their predictive scanning is making a difference.